We have a question, Thomas from Morinville. Thomas, the floor is yours, sir.
Thank you, panelists, for your valuable time today. My name is Thomas Holmes. I live in Morinville. I'm a school counselor at Nemeo School that supports students early childhood to grade 9. School counselors have become increasingly rare in many parts of the province, even though school counselors provide frontline assistance to students that face challenging personal issues, including concerns related to mental health. What is your party willing to do to appropriately support the mental health of every student in Alberta? Thank you.
Minister?
Thank you. That is a great question, because I can tell you that some work has already started. A few weeks ago, I had the pleasure of spending time at the Children's Hospital in Calgary in the psychiatric unit, speaking with a large number of psychiatrists, and we have already initiated some dialoguing with Minister Fred Horn, our Minister of Health, and it all ties around bullying. But obviously it will have other secondary benefits in the school, because for us to eradicate bullying, it's sometimes very difficult to identify the bully. Bullies tend to be good at bullying and they're difficult to catch. But we also have to develop the competency in identifying victims of bullying, and that plays into mental health as well. So you will see more collaboration. You know, my age perhaps may not indicate, but as you sense by my accent, my first 6 years of schooling was in Europe, where having a nurse and having a counselor in school was a norm. And I found that through my personal experience to be of a lot of benefit. And that is what my vision is, and that is where I want to head towards, to have those auxiliary services available within school, not only for the benefit of students, but also for the benefit of the community. Well, so you will see more collaboration and focusing on mental health in the context of bullying and all the other benefits that come along from it.
Thank you.
Thanks so much. Well, I think, first of all, I mean, this government has talked for a long time about wraparound services, and we need to, you know, work together and collaborate. But the fact of the matter is, we had more resources in our schools supporting kids who had special needs, who had mental health issues before than we do now. So talk is cheap. Unfortunately, making the really hard decisions, providing the services that our kids need is not. And so we need to make the proper investment. Ultimately, it comes down to this. Who do you trust to do the kind of work that will provide the support, both in our healthcare or in our schools, but in our communities broadly? We have a premier who made a bunch of promises. One of her promises was to have a broad-ranging healthcare inquiry, a public inquiry into intimidation. She broke that promise. So I'm not sure that you can trust this premier. On the issue of mental health, this government has the lowest funding per capita mental health in the country. We have half the national average of beds and spaces for people with mental health of the whole country. Yet we're one of the wealthy, or the wealthiest province in the nation. This is shameful. It's absolutely shameful. For the last 4 years, while we were in a boom and we led the country in economic activity, we froze funding to special needs kids. None of this can be allowed to continue. We should be quite ashamed of our record on this. We should put those resources back into the schools. We should put more resources into the schools, and we should provide a truly equitable access to education for all kids, regardless of the challenges they face when they arrive in our schools in the morning. That hasn't been happening. It has to happen in the future.
Thomas, you're doing God's work, and thank you. The other Thomas. I've been an inner city doc for 20 years, and I've looked after the homeless, the hungry, those without a voice. Suicide is the #1 cause of death, accidental cause of death under 44. We have more suicides than we have car accident deaths. And of the car accident deaths, you know what, 10 to 15% are actually head-on collisions or suicides. People get drunk, they go down the wrong way, and they hit a rig. I know because I'm a STARS dog. We have 60,000 kids seeking mental health services every year, my dear friends. 60,000. Mental health is a childhood illness. 50% of mental health issues present by age 14. It's the health of the mother preconception that determines the brain development. The symptoms are actually visible at 18 to 24 months. We need to embed mental health and addictions counselors into the schools. Even before they get to the schools, every mother needs fantastic prenatal care and postnatal care, and we need parenting coaches and midwives, and we must make this a priority. And closing Alberta Hospital Edmonton is not how you fix this problem.
Thank you, Raj Sherman.
Thank you.
I'm going to cut you off there, and Sue Huff.
I agree that absolutely we need a strong mental health strategy, and it's kind of odd to me that we don't have one. We also need an early childhood and learning and child care plan, which we also don't have. Our party, we're a brand new party, we're 2 years old, and we've introduced a bill to create an early childhood plan. It seems odd that a new party would have to do that, that wouldn't be already in place, and that we wouldn't have a good mental health strategy in place already. But we do have some rather serious deficits, and I think there should be counselors. To answer the question, I think there should be more counselors in schools that develop real relationships with kids, not just pop in and pop out. Thank you.
Mr. Marciano.
Mental health issues are one of the areas where our healthcare system is particularly failing. There's lots of things wrong with our healthcare system, but generally once you get into the system, it's pretty good. Not in mental health issues. And our party's just recently picked up a candidate who was a forensic psychiatrist at Alberta Hospital for a long, long time, and he was constantly fighting budget decisions that would have put inappropriate people back on the street because we have not properly set up the mental health system, and it's the area where the patients are least likely to be politically influential, and as a result, it's been the area where things have been ignored the longest, and it's got to be fixed. And the truth of the matter is, it does start in the schools, and we do need to create programs to identify folks right from the very beginning.
Thank you very much.